And welcome to another Rush Generations Health Education lecture. Rush Generations and our staff is delighted to be your source of information, resources, and health promotion programs to help maximize your well-being and good health as you age. Today is Wednesday, February 4th, and I'm Franco Samataro. I'll be your moderator for today's lecture, Cancer Prevention and Screening. Before I present to you the wonderful speaker joining us today, I'd like to first thank Hannah Weitzman for helping with the production of this lecture, helping us manage the chat and other key aspects so that we can all have a great discussion about common cancers in later life, prevention strategies, and screening. As always, we're live streaming this lecture via our YouTube channel using the video platform Zoom, which allows us to host a good number of people who join us via phone. Thank you so much for joining us. For those on YouTube, we ask that you please use the chat function to ask questions. In order to add to the discussion throughout the lecture, we will make sure that your comments and questions make it to the lecturer, the presenter. And for those of you listening to the discussion via phone, you will also have an opportunity at the end to unmute your audio so that you can ask your questions at that time. We'd like to remind you that all the information offered here is for general informational purposes only, and to always seek additional professional advice for situations specific to you and your needs. And now I'd like to introduce our lecturer for today. Alicia Van Slee, Physician Assistant Certified. Alicia has been a physician assistant for 13 years with clinical experience in infectious disease, orthopedics, and thoracic surgery. She earned her bachelor's degree in psychology from University of Illinois, Chicago, and her master's in physician assistant studies from Midwestern University. Cancer screening and prevention, health maintenance are especially important to her. She strongly believes that education and understanding are essential to caring for the body. After all, we've only got one. She lives in the southwestern suburbs with her husband, 2 children, 2 dogs, and a chinchilla. Without further ado, I'd like to welcome Alicia. Welcome, Alicia.
Good afternoon. Thank you for having me. Thank you, Franco, for the wonderful introduction, and thank you, Hannah, for allowing me this fantastic opportunity. I will share my slides right now. Can everyone see my screen?
Yes, we can.
Perfect. All right. So today, good afternoon. Thank you for everyone being here today. We're going to talk about early cancer detection, what it means, why it matters, and what adults 55 and older in the United States can do to protect their health. Cancer is a word that gets everyone's attention. Most of us know someone, a friend, a spouse, a sibling, or a parent who has dealt with cancer. And we're being honest, many people avoid thinking about it until they have to. But here's the important truth I want to start with. Many cancers, when found early, are highly treatable and in some cases curable. Early detection doesn't mean you're looking for trouble. It means you're giving yourself more options, better outcomes, and more time. So today, we'll cover what is early detection. Number 2, most common cancers in adults 55 and older. Number 3, recommended cancer screenings in the United States. Number 4, barriers and health disparities. And number 5, role of lifestyle in cancer prevention. This talk is about empowerment and not fear. First off, what is early cancer detection? Let's start with the basics. Early cancer detection means finding cancer before symptoms appear or when symptoms are mild and easy to miss. Cancer affects many U.S. families. As we know, risk increases with age. And early detection saves lives, such as mammograms, colonoscopies, lung scans, PSA blood tests. Many cancers have no early symptoms, so it's important to pay attention to your body changes. Notice things like unexplained weight loss, persistent pain, changes in bowel habits, new lumps or bleeding. Screening tests when you feel well. Early detection matters. Cancer is usually smaller and localized. There are more treatment options that are often less aggressive. Survival rates are significantly higher, and quality of life is often better after treatment. To put it simple, the early cancer found, the easier it is to treat. So, next is most common cancers in adults 55 and older. Cancer can occur at any age, but age is the single biggest risk factor. Here's why. Over time, our cells accumulate damage. They replicate over and over and over and over again. There's bound to be mistakes. Immune system is less efficient. And then we also have longer exposure to risk factors such as tobacco, alcohol, sunlight, environmental chemicals. Most common cancers here in the United States are breast cancer for women, prostate cancer for men, colorectal for both genders, lung cancers, as well as skin cancer. And if you see this picture to our right, this is cancer deaths in the United States. You can see for both men and women, lung cancer is the most common cancer death. And if you put prostate, colon, pancreas, and together, as well as breast, they all still don't match up to lung cancer. About 70% of all cancers are diagnosed in people 55 and older, and most cancer deaths occur in this age group. This doesn't mean cancer is inevitable. It means screening becomes more important, not less. So now, well, the recommended cancer screenings in the United States. Let's talk about cancers that most commonly affect people in this age group and what screenings are recommended for ages 55 and older. These guidelines may change slightly depending on health history, so always talk to your healthcare provider. First is breast cancer, most common cancer in women. Often no early symptoms. It's highly treatable when found early. Risk increases with age. Usually there's no symptoms early on. So the best early detection is mammograms. So mammograms, you start between about age 40, sometimes a little earlier, and you get it every 1 to 2 years. And when it's caught early, your 5-year survival rate is about 99%. And this is typically recommended until the age of 74. Continue longer if you're in good health. Prostate cancer. This is the most common cancer in men. It often grows slowly and also doesn't cause many symptoms at first. Early detection allows monitoring or less aggressive treatment. The type of screening for this is a PSA blood test that can be done with your provider. You start about the age of 55, but some may start earlier, so talk with your healthcare provider, especially if you have family history of prostate cancer or if you're of African American heritage. Colorectal cancer. This is a cancer that affects both men and women. It often starts as a polyp, and it's very preventable. Gold standard is to do a colonoscopy starting at age 45. Yes, there is a stool test that can be done, but it is highly advised to continue with colonoscopies. This continues until the age of 75. Usually colonoscopies are done every 10 years, but if your provider finds some polyps or some pre-cancerous cells, then he or she may advise sooner colonoscopies and testing. The stool tests, if you are truly unable to go under colonoscopies or fear the colonoscopy, then you can do that every 1 to 3 years. Lung cancer screening. Lung cancer is the leading cause of cancer death. As I spoke earlier, the lung cancer, if you put prostate, colon, and breast all together, add them all together with the cancer deaths, lung cancer still beats all of them. So this is strongly linked to smoking, often found late without screening. And we are working on early detection to save lives. And this is done with a low dose CT scan. The United States Preventative Service Task Force has come up with the current guidelines. So this is for people that are most high at risk, which are smokers and former smokers. So for the guidelines, you must be between the ages of 50 and 80, a current smoker or a former smoker that quit in the past 15 years, be no symptoms of cough or bleeding or recent illnesses. And this is done annually. So it's just like a colonoscopy, it's just like a mammogram, it's just like your PSA. This is important to do annually. Um, this this is able to find spots early on your lungs, and then that way, if we do find something that is cancerous, this can be treated quickly with either with surgery or with radiation therapy. So please, if you are a smoker or former smoker, get a low dose CT to save your life or a family member. Next is cervical cancer. This is for women. This starts at the age of 21. Your annual gynecologic exam with your pap smear and your HPV testing. This is done every 1 to 3 years. And you can stop usually by 65 if it's normal. And then the other is skin cancer screening. This starts at any age. As you know, we're all exposed to sun. We all are exposed to that risk factor. So it's important to look at your own skin every day, every week, every month. Just find a date and be continuous with it. Look at the ABCDs of skin cancer. So if it's asymmetric, A. B for border, if the borders are funny looking. C, color, if there's multiple colors in your moles. D, diameter, if it's greater than 6 millimeters, that could be risky. Or E for evolving. You notice that it was small in the beginning, but now it's a little larger or it's doubled in size. When you feel that you have some risky lesions, do get exams from a dermatologist. You can do this every year. Barriers in early detection. If early detection is so effective, why don't most people get screened? Here are the most common reasons. Fear. Fear of bad news. Fear of procedures. Fear of treatment. But avoiding screening doesn't prevent cancer, it only delays diagnosis. Delaying diagnosis will delay treatment, which will be more aggressive treatment. 2, I feel fine. I feel healthy. Many cancers cause no symptoms early on. Feeling fine does not always mean everything is fine. Cost and concerns. Most screenings are covered by Medicare and insurance. Free or low-cost programs exist in many communities. Many preventive tests are free. Look into your communities, into your programs. Confusion. Different guidelines. Conflicting advice. Uncertainty about what's needed. So this is why it's very important to have a primary care provider. Find one so you can create that trust, create that person to talk to and help with that conflicting advice. Language barriers and trust barriers, and even transportation is limited. So these disparities lead to later diagnoses, worse outcomes, and higher mortality. Improving early detection saves lives, especially in underserved communities. So what can you do starting today? Role of lifestyle in cancer and prevention. Here are practical steps everyone can take. Take small, realistic steps. Know your screenings. Now that we've listened to this video, you will have a better understanding what's out there for you. Keep your health records. Keep it in a notebook. Keep it in a binder. Keep it on a Word document. Put all your surgeries, your medications, what you've been screened for, your family history is important. We see links to that. Don't ignore changes to your body. Ask questions. Encourage your family and friends. Stay up to date even if you feel healthy. Early detection is not personal, it's communal. And lifestyle matters. Don't smoke or get help quitting. There are many free community Illinois way programs out there. The 1-866 quit yes, 1-800 quit now. Text quit to 447-848 to help you get started. And Rush even has a smoking cessation community. So get in touch, get your providers to help you with that. Limit alcohol. Both smoking and alcohol have shown links to not only lung cancer, but mouth, esophagus, bladder, kidney, pancreas, stomach, colorectal, breast, cervical. They all have toxins that allow for cancer to grow. Eat healthy foods. You've heard it. Eat the rainbow. Eat some color throughout your day. Stay active. If you don't use it, you lose it. Maintain a healthy weight. And then also protect your skin. Not only using sunscreen, but covering up or avoiding those high times of UV during the day. So key takeaways today. Cancer risk increases with age. Early detection saves lives. Get your screenings. Talk to your provider. Know what you are able to get. Screening works. The quicker we find a diagnosis and more localized the cancer is, the easier and quicker it is to treat it. Knowledge is power. Share your knowledge. Talk with your community. Talk with your providers. Communicate with the provider and community. And I want to leave you with this thought. Early cancer detection is not about fear. It's about control. It's about taking charge of your health, giving yourself the best possible chance, being there for people who matter to you. Getting screening is an act of respect. Thank you for your time, your attention, and your commitment to your health.
Thank you. Thank you, Alicia. I have some thoughts, and we'll definitely be opening the floor for some questions. So for those callers that are joining us right now, in a couple of minutes, we'll open up the floor for questions for Alicia Vansley, who's our physician assistant, joining us today. And for you, our YouTube viewers, again, feel free to add your questions to the chat, and we'll make sure that they get to us. But before we get going, I do want to say thank you so much, Alicia, for the clear and empowering presentation today. Today we learned so much about why cancer risks increase as we age, and then the early detection, why it's so important, especially because many cancers don't have symptoms in the early stages. So that's definitely a great reminder for myself as I continue to embark on my life journey and my own screenings and the need. You walked us through the most common cancers affecting older adults over 55, including breast and prostate, colorectal, lung, skin, and cervical cancer, and explained the recommended screening guidelines, when to start and how often, or why it matters, obviously. And then we also talked about common barriers, the screening, like fear, cost, confusion, and access, and how lifestyle choices such as not smoking, staying active, eating well, and protecting our skin can play a powerful role in prevention. Most importantly, you reminded us that screening isn't about fear. It's about control, quality of life, and staying healthy for the people who matter most. I love your quote, screening is not looking for trouble. With that, let's open things so that for questions and discussion. So thanks again, Alicia. Anyone joining us on call today, feel free to join us by hitting *6 to unmute yourself if you have a comment or a question right now. from YouTube, one big concern is Medicare, limited or no coverage for some of these procedures. Example is lung screening. If you haven't
Mhm.
if you haven't smoked, but this cancer can occur in non-smokers.
Yes, so that is our big disparity we have right now that we are fighting with our lawmakers, with the insurance. But unfortunately, right now, non-smokers are not part of the lung cancer screening. We are, there were studies only done on people that were smokers or current smokers, and they're the most high risk. Yes, we do. I'm in thoracic surgery. We are cutting out cancer every day. So we do see people, I would say 2 to 5% of them are non-smokers. Most of them are smokers. Um, we are, we have people fighting to try to have the non-smokers have CT scans, but unfortunately right now we are limited by what the USPSTF or the United States task force has allotted and what insurance is allotted. And right now, it's people between 50 and 78 for Medicare. Yes, even Medicare is putting those last 2 years, 78 to 80, that cannot get lung cancer screening. But between 50 and 78, you have to be a smoker or a former smoker at some point in your life. And unfortunately, that's where we're at right now. But more studies are coming out, so stay tuned. It's a very new development.
Thank you for that. I mean, that's something that definitely interests me as a non-smoker as well. So that's
Yeah.
something that you hear about that, but 2 to 5%, while it might seem small to some, if you look at
Mhm.
it in the scheme of things, it's still a relatively large number in the large population to think about that are not being covered by this. So thank you for sharing that.
Yeah.
Along those lines, that was one of my questions that I had as well as you mentioned a community programs might be available, and the barrier that they just this viewer just talked about not having those screenings covered. Are there any community programs that could help in this situation, or community programs in general for folks that may not have insurance that you know of?
Good question. Rush has many low income or the Cook County community centers are places that you could start. Um, those would be the best ways to look into it. Um, and people and I specialize in lung cancer. So we do have a nodule clinic and a lung cancer screening clinic that's run by a nurse practitioner and wonderful nurses. And if you want to get in contact with them, they could help kind of push you to the right direction. But they also will notice that they will also discuss with you that people that never smoked don't have that opportunity with that, but there may be other avenues to try out, and then they can also provide further details for that.
Thank you, thank you. Um, Somebody from YouTube as well. Why should I do a colonoscopy over a fecal occult blood test?
Good question. Um, Fecal occult blood test. So that is telling you fecal occult blood means you're looking for blood in the stool. Blood in the stool can be a lot of things. It could be cancer, it could be hemorrhoids, it could be ulcers. So that doesn't really give you the full diagnostic approach. And there's all there, and you've probably seen the Cologuard commercials too. Um, those are not as sensitive. Um, the Cologuards will notice you have possibly some cancer cells, but it might be to the point where that polyp has turned into a tumor. Um, so I and everyone still talks about the gold standard would be going through the prep, getting the colonoscopy, having the provider go in there, find those polyps, remove those polyps, and you are cancer free. So even if you get the fecal occult blood test or the Cologuard, your provider would be like, "Hey, this is abnormal. Guess what? We need to send you to the GI doctor to get this looked at. So just bite the bullet, get it done. And this is the number one most preventable cancer. You go and get your colonoscopy, cut it out, and have it done.
Thank you for that. Thank you. Um,
Mhm.
Along those lines, sort of along those lines, what do you say to patients who are afraid of screening results, or who feel, or on the other, or the flip side, maybe a patient who feels healthy and doesn't see the need for screening?
Mhm. Screenings are put out there for a reason. Um, Not only is it to um, help you find things early, but it's also monetarily. You know, if you find a skin cancer that's localized to just your skin, you go to your dermatologist, he cuts it out, and that's, you know, a, a few grand from the insurance. But if it becomes a melanoma, and then say it's such a it becomes so big, and then the melanoma spreads to the brain, spreads to the lungs, then you're talking about chemo, immuno, we're talking about radiation, we're talking about further and further down that monetary road, and just further burden. So the earlier things are found, the easier they're to treat, and there's less trips to the doctors, less trips to getting more more testing, more invasive procedures. Um, so if we can get the even the skin or the colonoscopy or the lung cancer screening, you find it sooner and you get it, and it's just it's a quicker, shorter route. Can you still see me?
Yes, we can see you and hear you.
Okay. Okay. Okay, good.
Thank you for that. I mean, to me,
Mhm.
I think the word sometimes cancer is just so scary. But I knowing the rates, obviously they can increase as we get older. I wish that the word cancer screening would have been introduced to maybe my vocabulary as a younger adult, as something that I grew up with. Like
Mhm.
we grew up in school saying go to the dentist twice a year because they're doing an oral screening and making sure that your teeth are healthy and catching cavities. And I'm not I'm making a correlation that isn't 100% the same, but it is somebody who's like trying to prevent like tooth decay from becoming bigger and having to remove a tooth.
Mhm.
So
Mhm.
I look at screenings maybe in that same kind of realm of like I want to know the information versus not knowing, and trying to empower myself with that knowledge to work with then my medical team to come up with the best course of action. So I agree with you. Thank you so much. Another comment that came from Medicare, that came from YouTube about Medicare. When mammogram recommends ultrasound follow-up, Medicare won't cover. Do you know of any resources that could be available?
That's not my specialty. Who The best way to get in contact is either with the breast health organization that Rush has, or even with your provider to help appeal it, or um, or even call your insurance company and be like, what else do I need to do? This is part of my health. Please help me.
Thank you. Yeah, I also think of maybe national organizations like American Breast Cancer Association.
Mhm.
Um, it would be a good resource to at least go online and see if there's a chapter nearby where you're where you are to reach out to them, and maybe they might have some also again community resources that could be of help to you. For anyone joining us via call, feel free to unmute yourself if you have a comment or question. You just have to hit *6. See what else has come in. Something fun. Oh, fun. How can family members encourage screening without feeling pushy?
Hmm. Hmm. That is the issue of the day, right? It's us providers, we feel pushy, family members feel pushy. Um, we as providers, we're just like, I want to do this for you. I want you to be healthy. I want you to be around. I want you to be around for family and future events. So or you suggest if it's your mom or dad, hey, can I come with you? I just want to discuss with your doctor how things are going. We only hear 30% of what our doctors are saying to us. So I would like to hear, the other 70% or help you hear the rest of it so I can be your scribe or, uh, figure out a fancy fancy way of saying I want to be there with you and I want to be part of your health journey. Let's not keep this from each other. Health is important and it could be genetic. It could be um, passed down from lineage. So it's important for everyone to not to be ashamed of what they have and to share this journey because eventually down the road, if the screening turns into further treatments, then you're going to need the family community to help each other.
Well said. And something that actually was a question that I had was how can a patient come prepared for screening? So you kind of touched upon it by maybe bringing a family member. But what's another way that a patient can come prepared for a screening or appointment? What questions should they ask that provider if they don't have the luxury
Mhm,
of having a family
mhm,
member accompany them
mhm,
to a screening?
mhm. Usually the best place to ask is during your wellness exam. Insurance, Medicare, or any, uh, provider of insurance, they allow so much funding every year for your annual. So you should be getting your blood test. You should be asking your provider, hey, what kind of screenings am I able to do at this age? Um, Point me in the right direction of where I can help myself quit smoking or quit drinking or dermatologist I should go to. You should write all those questions down and also do your own little research too. Go to the different cancer sites, like you said, the breast cancer, the lung cancer, the colorectal cancer, and see what is available to you as well. Educate yourself.
Terrific, terrific. Another comment from YouTube, and actually question, can you discuss heart calcium scores? Scans, are they beneficial?
Mhm.
It's the question.
Yes, those are wonderful. Not only in it's a fast way and not a very invasive way for you to look at your heart. The calcium scores are looking at how much atherosclerosis are in your vessels around your heart. So then that tells your doctor or your provider if we need to change diet, if we need to send you to a cardiologist, or is your heart super healthy and we can just continue on just continuing what medications we're on. But incidentally, sometimes the fields on that CT scan do pop up with nodules, and we do find lung cancer that way too. So that's another benefit, I guess I would say, from that. But it is a quick procedure that is not invasive like a angiogram or going for a stress echo or anything. So I would say that's a good starting point if you're interested in your heart care.
Yeah, and I'll add my 2 cents on that is I personally have done it myself,
Hmm.
and
Hmm.
yes, they're very low invasive. They're not invasive to me at all
Hmm.
because it didn't
Hmm.
require blood draws or anything like that. It was basically
Hmm.
getting scanned, and it was low
Quick
cost, and it
scan.
was something that was
Hmm.
yes, a quick scan, and it was
Hmm.
definitely something that my insurance did not cover, but it was a very nominal cost through
Hmm.
the healthcare provider as well. So I know that a lot of places, well, that do some of those screenings can stay within like $100 or below.
Hmm.
So that could be if you're interested and you see that your insurance may not cover it, find out what the cost might be from that provider, because that one's surprisingly sometimes accessible.
Affordable. Hmm.
Yeah, great. Any other questions from our listeners or YouTube? Please submit now for our final questions as we move forward to our what is going to be happening next through rush generations. I know a question that I have for us is as our older adult population, what lifestyle changes have the biggest impact on cancer prevention?
I would say minimizing the exposure to all those risk factors. So if you can, quit smoking or avoid smoking altogether. Limit your alcohol consumption because both the smoking and alcohol both have carcinogenic factors that can allow cancer to grow. Staying active, you know, if you increase your it increases your immune system, it increases your ability to move, that increases your just your body's function. And then covering up from the sun because the UV rays definitely during the summer and then you know in sunnier parts of the world, they can cause eventual skin damage. So all those things kind of added together.
Thank you. Um, I knew something I struggled with a family member is how does smoking cessation still benefit someone later in life? Because that's something
Mhm.
that I know that I had struggles with a aunt of mine who they were like, "Well, I lived a long life. What does it matter now?" It was the answer that I got. So, what would you say to
Mhm.
someone
Mhm.
like that?
So smoking doesn't always cause cancer, but it does cause lung damage. Just not everyone gets the lung cancer, but everyone gets emphysema, everyone gets COPD. So we struggle with it every day as providers to try to help people quit. Even after surgery, people have trouble quitting. Even they went through the lung cancer, they went through the surgery, they went through the chest tube, they went through the days and they went through chemo and immuno, and they still continue smoking. So it's a very difficult situation. The best is just to keep trying, um, provide all those. It's really both psychological and mental and physical. So it's not just throwing away the cigarettes. It's having the behavioral changes, having a counselor or a therapist or the quit line to help you decide what best ways to try to quit smoking. But in fact, if the person doesn't want to, then you will never be able to get them to quit. Um, so it starts with that. Any addiction, let it be alcohol, cigarettes, gambling, you have to want to. So when they put their mindset, I do want to, then that's when you can start opening that door.
That's a great tip. It's something to definitely for me to think about is not feel discouraged
Mhm.
by
Yeah.
wanting to encourage those folks. Um,
Mhm.
Something that came through YouTube, when should someone seek a second opinion related to screenings or symptoms? Like if maybe I don't know how I would take that if somebody maybe has gone to the provider and are asking if they should get a screening or if they don't feel comfortable with the screening results.
Okay, so let's say for lung cancer screening, I feel like that's the biggest one right now. Um, we, we have it's very new. Maybe in the past 10, 15 years, low dose CT scans have come into regular practice. Um, so some providers feel that X-rays have been okay, but they're not gold standard. They don't catch things. So if you feel like your provider you fit that criteria, the 50, the 80, you're a current smoker or a former smoker, um, seek out a nodule clinic, seek out research where there might be a lung cancer screening network in a facility, or for breast, seek out a gynecologist or your primary, and but mammograms, you can walk in and get a mammogram as a woman, or cervical screenings. For prostate, I mean, go to your urologist if your primary care doctor doesn't want to do PSAs. Go to the providers that, or go to a provider that, deals with it all the time. So a a breast oncologist for mammographies, a pulmonologist or a thoracic surgeon for lung cancer, your dermatologist for your skin cancer, go to a GI doctor for your colon. So if you don't like what your primary care provider is dealing out to you, then go find those specialists that deal with it day to day.
That's a great recommendation. I agree.
Mhm.
I think it's very smart to go to those to the specialists that see this on the daily, like you said, like yourself, who are helping those patients with those screenings, talking about what you know preventative measures, or like this is the right call for you, or what's next for you. So thanks again for the reminder.
Mhm.
As we come towards the end, do we have any questions left from our YouTube? I'm asking our producer. And then if anyone who's joining us via call right now and have a comment or question, feel free to hit *6 at this time. Otherwise, Alicia, I'd love to invite you to uh, give us one last closing thought for today in cancer screenings.
Of course. Thank you again, Franco and Hannah, for allowing me this opportunity. This was wonderful to talk with all of you, answer any questions. But like I said, in the very end, you are the one that's taking care of you. Your provider is giving you ideas and showing you what is available. But in the very end, please take care of yourself and know what is available to you and push for your health, okay? And for your family's health. So it's screening is saving lives. It's also helping you catch it early if we do find a cancer, and then your treatment is much less aggressive and much more durable than dying from it or going through more extensive treatment.
Thank you. Thank you. Thank you.
Mhm,
Thank you.
mhm.
Okay. And now we're going to talk about, thank you for joining us again, Alicia. We're going to talk about what's next with our Rush Generations and our upcoming programs. So our first program that I want to talk about is Learning to Live Well with Chronic Pain. It's a 6-week workshop for people living with chronic pain. Participants engage in discussion and skill building activities to better cope with day-to-day management of chronic pain. All sessions incorporate an exercise element and strategies for medication management, pacing activity, and rest, etc. Our next workshop will be held via Zoom on Thursdays, starting February 19th through April 2nd, from 1 to 3:30 p.m. If you'd like to register, please call our 1-800-757-0202. Spots are still available. Next, I'd like to talk about Shalom Senior Voices. Shalom Senior Voices aims to empower older adults to discuss what matters most to them as they age. It's important to share what matters most to you with your physician and loved ones. So Shalom Senior Voices wants to hear from you. Please consider sharing your wisdom on why it's important for your healthcare team and loved ones to know your goals and wishes and what matters most to you at aging.rush.edu/Shalman/collaborate-and-connect, or you can scan the QR code that is present right now on the screen. Our next lecture is going to be on February 18th, 2026, and it will be heart health. Again, it'll be at 1 p.m. as always from 1 to 2, and we hope to see you there. And lastly, thank you for joining us today on our lecture for cancer screenings. And as always, we thank you for joining Rush Generations. You can always reach out to us at 1-800-757-0202 or visit our Facebook page at facebook.com/Rush Generations. Please take care of yourself